Hi, good afternoon. I'm Tina Dale with the Fairfax County Health Department, and today we are broadcasting live from South Lakes High School here in Reston, Virginia. And we are here today to continue our conversation on medication safety. The Health Department and Fairfax County Public Schools are taking this topic very seriously and are committed to the safety of our children and have a number of programs in place to address this and to help keep medication out of the hands of our kids. So joining me today is School Health Promotion Nurse Gail Sikowski. Gail is also a member of our School Health Promotion team. Gail, thank you so much for being with us today. Tell us, why is it so important that we do keep these medications out of the hands of kids?
It's very important to keep medications out of the hands of children. We want to protect our families, our community, as well as our environment by proper education, storage, and disposal of medications. We want to make sure we store medication appropriately and educate parents on usage to prevent kids from accidental poisonings and teens from misuse or abuse of medications. We also want to dispose of any unused or expired medications promptly and properly in order to avoid contaminating our water supply. I'm part of the health promotion team, an amazing team in Fairfax County, and behind me you'll see our medication safety display that we create to take out into the community and to the schools in order to educate parents so they can better make decisions on what's best to provide care and keep their kids safe from medication, overdoses, misuse, and also protect the water supply.
So what would you say is the number one way that parents can keep medications out of the hands of their kids?
The number one way to keep medications out of the hands of their kids is to have a secured location, and we recommend a lockbox. You can have a lockbox or a locked cabinet or both. We want to make sure medications are up and away from our young children. Remember, medication looks good and also tastes good, and so does candy, so our kids can't differentiate between the two. So we want to make sure that we have our medications locked up, as well as educate our children on the usage and dangers, that this is medicine, not candy. We want to educate our children on only take medication from a trusted adult, and also never share medication. So there's a lot of education to be done in the community to keep our kids safe, as well as locking up our medications.
That's great. So last month we did a Facebook Live with Fairfax County Police, and we demonstrated the lock boxes that are now available in all of the police stations throughout Fairfax County. But there are other ways that we can keep medications out, that we can properly dispose of medications. So Gail is going to do a demonstration today, and we've invited a senior, John Runley, to be with us today. And John is going to help Gail with a demonstration here. So Gail, talk about what you have right here.
So there are two options for disposing your medication at home. Remember, we want to throw medications in the trash. No longer do we flush medication down the toilet or pour medication down the drain. You can go to any health department district office, as well as the Joseph Willard Health Center, and get a Detera kit. This is a deactivation kit. Very simple instructions on the back. Follow the instructions, put your medication in there, and discard in the trash. The last option is an option to do it at home, and there's 4 simple steps in order to discard your unused and expired medication. So I'm going to have John help me with a demonstration. And the first thing you want to do is you want to look on your prescription bottle to see if there are any instructions for discarding the medication, and there is not. Second, you want to mix your medication with something inedible and unappealing. You can use cat litter, you can use soil. I have a lot of coffee grounds, so I'm going to use coffee grounds. We're going to pour the medication in and mix it around. And then we're going to actually put it in a sealed baggie. And we're going to actually throw it out in the trash. We can actually either leave it in this container or put it in a baggie. And then we're going to throw it right into the regular trash. And the last thing we're gonna do with our prescription bottle is we wanna make sure to scratch out all the personal information that is on our bottle of medication. So we're gonna throw the baggie in the trash as well as an empty prescription bottle. And you wanna make sure that you do this from time to time, that you go through and discard any unused medications so that it does not get into the hands of teens or children.
Fantastic, that's great information. So just a reminder is that you can use the drug disposal boxes that are located at the police stations. You can use a drug disposal kit that you can get from the health department, or you can simply follow the steps that Gail and John demonstrated. So John, we're going to invite you back over in a few moments, but I am going to invite Heather Price to join us. So if you all are just tuning in, I'm Tina Dale with the Fairfax County Health Department. We are broadcasting live from South Lakes High School, and with me today is Heather Price to talk about steps that the Fairfax County Public Schools are taking to really address some of the medication safety issues that we have in our county. Heather is the Substance Abuse Prevention Specialist. So Heather, thank you so much for being with us today.
Yeah.
So let's talk about really the nuts and bolts, right? Opioid medications, pain medications. That's one of the biggest things that's in our community right now that is a risk. So what happens to teens when they take opioids?
So it's very similar to what happens to adults, and we kind of look at it in two different fields, the mental and the physical. So a lot of times with teenagers we're seeing wild mood swings, out of characteristic emotions, paranoia, disorientation, lack of inhibitions, and then more on the physical side we're seeing sleepiness, confusion, nausea, constipation, breathing problems, and then ultimately down the line addiction. And we've learned that anyone, it doesn't matter your age or your any of your demographics, you can become addicted to opioids in 3 days, as little as 3 days. And so a lot of times we're more so worried about the withdrawal symptoms because they are so intense with opioids. And those include a very intensified flu, is how it's described, the bone aching, vomiting, cold sweats, fevers, and that can last for 3 to 4 days, depending on quite a few factors. And that just perpetuates the addiction at that point, because the easiest way to get rid of those is to use more opioids. So that's kind of, what the angle that we're taking in the community to educate teens on this.
Excellent. So what is happening in the schools? How are you all getting that message to the students?
Yeah, so we have a very long list of different things that FCPS is putting into place to kind of help with the opioid epidemic. I'm only going to talk about 3, but we have more information on the Student Safety and Wellness website, and you can get more comprehensive services there. But this is our first year having this Substance Abuse Prevention Specialist program put back into place through the schools, and we're located at 7 different schools. Obviously South Lakes, Herndon, Robinson, Langley, West Potomac, Bryant, and Mountain View Sheriff's Apps. And the thing that we do the most is kind of counseling and psychoeducation. We try to educate youth on different gateway substances and how that can lead to opioids, or if they already are using opioids, or the different aspects of addiction in regards to opioids. We're doing that pretty much all day long. And then some of the other things that Fairfax County does, public schools do, is the alcohol, tobacco, and other drug 3-day seminar. So that students can either volunteer for that, or if they have an SR&R infraction, they get sent to that typically. So it's 3 days of psychoeducation, again, and they extensively cover opioids, talk about all the other drugs and emotions and all that stuff, but opioids are very well covered in that. And then there's a parent night component to that as well, where you can get education on different paraphernalia, and they talk about drugs and addiction as well. And then the biggest thing that we've done this year, FCPS has put into place this year, is the 11th grade lesson. So we're going to every 11th grader in Fairfax County Public Schools and giving them a comprehensive lesson on all drugs, but mostly and majorly covering opioids as well, and the addiction process and all that stuff, so that we can hopefully prevent some of this stuff from happening down the line.
That's great. So I'm going to ask John to come back over. So John, thank you again for being with us. John is the senior here at South Lakes High School, and we love to get their opinion. So John, kids who might be using pain medications, opioids, that type of drug, really, what should parents be on the lookout for?
So parents should be on the lookout for their kid kind of withdrawing from family activities, withdrawing themselves from other interactions with their family, having bad grades, skipping class, maybe leaving sports or activities that they used to really enjoy, leaving the house without telling anybody, or maybe like telling their parents they're going somewhere but not being specific of who they're going with or where they're going.
Excellent. So if a parent maybe suspects that their kid might be misusing drugs, what should a parent do?
So a parent should sit down with their kid, have a good, honest conversation, make sure that the kid feels that they're safe in the area that they're with, and then talk to them about, hey, what's going on? Why are your grades slipping? Why are you leaving at these times, or not telling us where you're going? Or maybe set up some new rules of the house to keep their kids in, so that their kids are more honest with them.
Excellent. So it's opening up that line of communication and trying to foster the honesty with your kid.
Yeah.
Excellent. Great, John. I really appreciate you giving us that perspective. So, Heather, what can a parent do? So in addition to talking to their child, what resources do we have here in the community?
Right, we're very lucky in Fairfax County. We have a great community services board, and they're typically like the catch-all. So they're a great, place to call to pick up the phone and ask, like, where do I go from here? Do you have services for me? Do I meet the criteria, or is there something else available in the community for me? As well, you can call Fairfax County Public Schools, the Student Safety and Wellness Office, and we can also direct you in the proper kind of road for you to go down. And then, of course, any trusted counselor or doctor, physician can hopefully help you make these important decisions on how to help your children.
Excellent. This has been some great information. I really appreciate you taking the time, Heather, to be with us. And thank you very much, John, for giving us your perspective. And a big thank you to our public health nurse, Gail Zukowski, for joining us today. So if you would like to get more information on the drug disposal that Gail demonstrated, please go to fairfaxcounty.gov/health and search drug disposal. If you would like to get more information about the Community Services Board and the services that they offer, please go to fairfaxcounty.gov and search Community Services Board. And if you would like to get more information about the student safety and wellness services that Heather spoke about, please go to fcps.edu and search Student Safety and Wellness. So a big shout out to South Lakes for hosting us today. Thank you all for joining in. If you have any comments or suggestions, we invite you to use the comment section below. So I thank you again for joining in, and please have a great day. Thanks so much.